first want to thank you all for your willingness to participate in our opioid committee. And I think the first thing that we should do is just introduction. So I won't start first. We start with Kathy. We can start with Kathy.
I'm Kathy Hazlett. I am the Substance Use Prevention and Treatment Program Manager for Greenville Vance Public.
I'm Quentin Woody. I'm a paramedic with Vance County EMS.
I'm Tori Childress Lassiter, Chief Operating Officer, Vision Behavioral Health.
Good afternoon, everyone. Multiple hats. Sandy Cowan. I'm a Vance County Magistrate and the Program Manager for Mobile Crisis and a community member for Vance.
I'm Dan Brodman, I'm Vance County Commissioner and also serve on VIA Governance Board.
I'm Yolanda Finster. I'm a member of the Vance County Board of Commissioners, representing District 6.
Renee Perry, County Manager.
Sharice Fain, I'm Commissioner for District 3, and I'm also a registered nurse.
Elliot Clark, VIA Health Regional Director.
Ebony Mitchell, Program Administrator for Vance County Social Services.
I'm Jacinta Johnson. I'm the Executive Director for Legacy Human Services. We're a nonprofit operating in the county. We operate the Addiction Recovery Center for Men on County Home Road, as well as Back on Track Substance Abuse Intensive Outpatient Program on Academy Drive.
I'm Kelly Stanley, live in the community, and I'm a person in long-term recovery.
Well, it's nice to meet all of you today. This is an exciting time for Vance County. The county has been receiving opioid funds since I believe 2021 or 2022. So we're excited about being able to move forward with some plans and recommendations to our commissioners. So if you all look at your packets, there's an agenda. And what I hope to accomplish today is this agenda is kind of loaded. So some things I think we should just make some revisions to. But I think first thing you all should do is election of committee officers. So I would recommend electing a chair, a vice chair, and I can actually serve as the staff liaison and do the secretary work as well. So we can mark that out. If you all think differently, we can do a secretary, but I'll have to do the reports out to the commissioners more than likely with the support of the committee. So if you all want a secretary, that's fine, but I do think you all should move forward with the election of a chair and a vice chair. But I'll let you all make that decision. Someone else just came in?
Yes.
Hey, how are you?
Hello. My name is Brenda Fogg. I'm a community advocate and the support.
Okay, all right. Thank you so
Nice to
much.
meet
It's nice to meet you.
You want to chair?
I got you. All right.
I'll nominate Sandy Cowan for chair.
I'll second that.
I nominate Yolanda Finster.
So I guess since I'll act in this role for now. I guess since we have a chair, we have a second to the motion from Commissioner Brumman. All those in favor, say aye.
Aye.
Okay, all right. Any nays? Okay, all right. So Ms. Sandy Cowan is chair. All right. And so Ms. Cowan, do you want to do the process for vice chair since you'll be chair?
Yes. All right, Ms. Finster.
Okay. Okay. All right. So Ms. Finster.
For vice chair.
Vice chair, yes,
Okay.
correct. So
Second.
just need a second.
A second.
Okay. All those in favor?
Aye.
Any nays? Okay. So Ms. Finster is vice chair. All right. Okay, all right. And so, as I stated earlier, I will be serving in the role as staff liaison as well as your secretary. And so I'll be responsible for all notes, meeting minutes, and things of that nature. All right, and so if you're looking at your agenda, we're on number 4. And so overview of staff support responsibilities, this pretty much means I'll be responsible for coordinating your meetings, record keeping, and all reporting to the Board of County Commissioners. And I said that earlier. And let's see. Okay, so Ms. Cowan, do you want to entertain some conversations about how often you all would like to meet so we can set up a schedule that's best for everyone?
Yes. So do you guys think that we should meet on a monthly basis or every other month? I know we all have things on our plate. I'm really good at sending and responding to emails. So if every other month is acceptable, we can do that, but I'm definitely open to other suggestions. This is a group effort.
I think monthly.
Monthly, that's fine, yes, ma'am.
Mhm.
So we can
Maybe
do monthly.
monthly initially, and then if we get into things, maybe change it to
Mhm.
That
bi-monthly.
sounds good.
Yep, sounds like a good.
Need a motion for that.
Yes, just first, when you say monthly, let's go ahead and set a date for the current meetings. So for example, today, what's today good for you all? The second
It's good.
Tuesday?
Second Tuesday of the month
Does
works.
that work for everybody, for the most part? Okay, and I'm gonna send out a schedule, so y'all don't have to worry about, keeping up with it. I can actually do calendar invites, if that's okay with y'all.
Yes, ma'am.
I think that'll be easier.
And is
So we're
this time a
saying-
good time for everyone?
3 o'clock, okay, 3 o'clock?
Would maybe earlier, it's like childcare picking up from school.
Oh, yeah, that's
Okay.
up to y'all. Y'all wanna do earlier? I can do
1
whatever y'all
o'clock,
want
2
me to do.
o'clock?
1 o'clock should be good.
1 o'clock, okay?
Somebody's just got to get the kids around for 3.
Okay,
Okay.
okay, absolutely.
1
So
p.m.
1 o'clock, second Tuesday every month.
Okay.
Everybody okay with that? Okay, absolutely. All right. Put this on my calendar for the initial, and I'll send out the invite later. Okay. All right. And let's see. All right, and so in your tactics, and of course, we won't go over this today, but there is a North Carolina MOU, which pretty much dictates what we all can, spend the opioid funds on. And so we won't dive into this today, that'll definitely be for another meeting, because this is a loaded, document. But there's 2 options, it's option, I believe it's A and B. And if I remember correctly, I'll pull out my minutes from previous board meetings, but I believe the county chose option B at some point historically, probably 21, 22, when all of this came about. I believe the county, approved to move forward with option B. Two options. That's right. So I believe it was option B. But I'll look at that and have the information for your next meeting. But I'm almost 100% sure it was option B. Yes, so, but like I say, just, put your eyes on this and read through this before your next meeting. And I can provide any guidance, moving forward as well. And so, of course, the MOU has information about allowable uses for the settlement funds and reporting and compliance requirements that the county is required to do. We are required to have an annual meeting every year, and we've done that up until September of last year. So we're on target with those moving forward. And so next one will be September 2026. We try to do it every September. So does anyone have information? I don't have this information with me. I thought maybe some people on the committee would have some of this information. Overview of the opioid impact, any overdose and substance abuse trends within our county, or current programs or resources within the county. Let's start having just open conversation about information. Because this is not my world, right? I'm here to support you all, but I think it's gonna take a collective effort for us to do this together. So do we want to just start some general conversations about any of this information and what direction you all would like to go in?
So I know that Hazel does do it in Granville County, so I know you have some reporting efforts of the overdose amounts and people for Granville. So what I wanted to do too, after this meeting, and now that I was elected chair, I want to get with you and talk about how you collect that data, so we can start doing the same thing, so we can have accurate numbers to share.
Yeah, and she actually sent me some information right before our annual meeting in September of last year, and I have it, but it's in email format. If I could get to it, I'll speak about it really quickly.
The chief medical examiner does put out monthly emails about substance use, and specifically opioid overdoses at the state level as well as the county level. Not all data points are collected at the county level, but it's a beginning. And then there's also information that can be also received on NC Detect, which is, I'm about to dive into that for Granville County. So those are 2 locations for data, in addition to then just going out into the community and interviewing people and, talking to folks as well, so.
And information that you shared, that you're talking about, we shared that at our annual meeting. I have the presentation right here.
Yeah.
I can't project it, or I don't have any way to share it, but I could print it real quick and get copies for everybody. Let me do that real quick. Hold on for a second. That'll be helpful for you all to look at.
And while you're looking for that information, because I'm a part of Mobile Crisis, we have had 16 crisis calls related to substance use overdoses for February. We haven't calculated the data from our chat.
It's gonna be on the admin copier. Okay.
I can also get, data on our end on how much Narcan we give, how many overdose patients that we typically deal with.
That's right.
I think, as Kathy mentioned, that NC Detect data is going to be really useful for us. If you go to the state's website and look at some of the information that's in there, it's a year old, and the NC Detect data will show you, and it'll extract information that's much more current. It is specific to just hospital visits.
Okay.
That's right, Kathy.
Yeah.
It was a part of that information.
Yeah, it was. So my information that I presented at our annual meeting had the ED visits for overdose involving medications or drugs with dependency potential. It also had fentanyl positive deaths and the dashboard for the payment schedule. So there's a lot of information on the information that Dewan is gonna bring back to y'all in a second. I just didn't think to print that for today. I'm sorry about that. And we'll take a look at that when she gets back.
And if you want any help with that data collection and, putting it all together, I'll be available.
That sounds good. Thank you.
So does anyone else have anything that we want to share or just start having conversations about anything on this agenda?
I would like to share something.
Yeah, that's me.
My name is Brenda Fogg. I'm an advocate. I had a 1-year-old grandson who passed away in 2024. And for that reason, I started on my path to learn as much as I could about it, since I didn't know what it was until it happened. And I started a group in this honor called Josiah Hope. Come out to the community. I passed out Narcan, and I cook dinners for the homeless, and I pass out test strips, and I try to do it. Well, to me, it's hard and I guess because of the stigma that followed it, a lot of people don't want to talk about it. But because of the pain that I felt and everything I went through, I can't let it shame me into a corner. So that's why I'm here. I want to be that voice to let people know it's okay to talk about it. Because anything you keep hitting is going to hurt. And to let people know that you don't have to be ashamed. And I want to share a picture of my grandson. I'm sorry, but he's on my mind every day, so I have to take him everywhere. But
Absolutely.
That's an excellent point that Brenda brought up, because we also need to be mindful of a distinction between opioid overdoses and fentanyl poisoning. Because a lot of young people will die by fentanyl because they've taken a counterfeit pill and not know that it's counterfeit.
What's his name?
Josiah Austin.
Josiah Austin.
Thank you.
Thank you, Ms. Brenda.
Thank you. For listening.
Y'all, the data's kind of small on there, but I know we're not gonna dive into it today anyway, but I'll email this presentation out as well. Oh, you still gonna see it? Okay, small. It's not.
Yeah, I see.
But I'll email it to y'all. I think at the next meeting, we'll be more prepared to have more discussions. I just wanted to have this initial meeting for introductions and to set up the structure of the meetings moving forward. I know there's not a lot accomplished today because this was our first meeting, but I'll email this out for sure.
Based on what Ms. Fogg just said, we do have a lot of child fatalities that are associated with incidental contact with fentanyl. On the Child Fatality Review Committee, we deal with those things. And that's an important part to realize is, I guess, like in the education part of it.
I think it would also be important, and I'm just starting to do this, I was just talking to Lee about this as I was coming in, to interview people who are in recovery or in treatment to learn their story. How did dependencies start? Are there resources that are missing in the community that would be helpful? Because I think, that's information that would be really helpful for me, and I'm going to provide that for the Granville Opioid Advisory Committee. And if the county's already decided on option E, that's where the prevention piece is.
Right.
And doing education, so having that information about Vance County folks who are in treatment and recovery, that would then enable us to really pinpoint those initiatives more directly, having that information.
There's a lot of opportunity for prevention education, not just within the school system, but you need a really close partnership, I feel like, with the school system to roll out some curriculum that really works. Resources otherwise that come down from the federal government are few and far between that supplement what the schools already do themselves. So I've seen opioid settlement dollars really help supplement school systems for beefing up some of their prevention education and then taking that to the parents.
I was on social media, I think it was yesterday, and I saw some school, I can't remember what school it was, the school system is now going to have Narcan on school buses. I saw that yesterday, and I'm like, oh, wow. Yeah, I mean,
I think it's much needed because, the children are experiencing and experimenting at, high numbers. And so, they're vaping and they're, experimenting and thinking things is, okay, and when it's not okay, and because people are making it and adding all of these additives to it. And so I think that's an excellent
So the Vance County schools have been trained in Narcan. The staff has been, and they all have Narcan in their school.
On hand.
Okay.
Oh, that's
I
good.
think
That's good.
I think that's one of the things that we see a lot of though is the education behind what addiction is. A lot of people think addiction is just a choice. But a lot of people don't realize that, it's no different than you go into McDonald's and eat a cheeseburger. It's still unhealthy. It's still gonna kill you.
Yep.
And you still love that cheeseburger the next day. But when it comes down to addiction, a doctor can prescribe, some sort of opiate for a back pain. Well, now you take that opiate away, now they're gonna find that fix for somewhere else. And so these kids, a lot of times they say, hey man, all these different songs and whatnot, let's go pop a pill and have fun. Well, they're having fun, just like you drink a beer, you have fun.
That's right.
But they don't realize it leads to dependence, and next once you get that dependence, you can't get off of it. I had a brother that tried to take the easy way from getting off of it. I actually had to save his life. I got another brother that's on it as well. So it's a lot of it. The twin brother of mine, that was just having fun. And when I grew up, I never thought of it like that. You had the DARE program back in the 90s. They said don't do it. Because it leads to other things, but they never really explained to the full extent, plus with kids. So the education aspect in these schools, what are we doing on that part?
Not much.
There needs to be education in the school and also in the communities, right? And that's empowering. So we need to find ways that we can reach parents. We need to give trainings and forums with choices, right? Because people have to work. We can't expect to hold a forum at 3:00 and catch every community member. So we have to ask questions, maybe do some surveys to find out when and where people would like to have these trainings at and go to them and really meet them where they are to make effective change with systems.
And even, being willing to go to the neighborhoods.
Yes,
and,
that's right.
and teach them, because everybody's not gonna come to a town hall meeting. Everybody's not gonna come, to a middle of the day meeting. And so when we go to the neighborhoods and look and see, okay, where we're having these high impacts, and then we can, help, tackle it as a community.
But not just that, but the post response to it as well. I mean, what options is there once they have that addiction? Like for us, we get Narcan. Our option is to take them to the hospital, but ultimately that doesn't do anything because then they level out and then they realize they can go home and do some more. So what's the post response?
Well, that's why we have peer support.
Right.
Right, to help with that transition and retention in recovery.
A lot of opportunities in post-overdose response. And, you see counties all over the state and country that have tapped in and started to build some of those.
It seems like
I think
our end, once we get the Narcan, that's the most vulnerable point that they have that we can get them into some sort of treatment. But it seems like the hospital is like that treatment. But what can we truly get them to?
Well, hopefully we'll have our BHUC coming online, our behavioral health urgent center. Our behavioral health urgent center, that's in process right now and should be, within 12 months or so, should be operating. Yeah.
That'd be great.
So
right behind the hospital. I can give a more updated presentation and overview to this group because there'll be a component for that facility. Obviously, a behavioral health urgent care is going to be available for folks that are in all kind of different levels of crisis. But the facility-based crisis and non-hospital detox component, the overnight multi-day component of that facility will help folks. And this population is tricky when you're talking detox. I mean, I'm not the professional. Some of our opioid clinicians in the community can help advise on some of this, but we're dealing with a lot of polysubstance abuse mixed with mental health issues that a treatment facility is the most appropriate place for them to be surrounded with care rather than let me go put a Band-Aid on in the hospital, keep somebody from dying.
Well, that's like, so my brother, he was in jail, and while he was in jail, he actually had help come to him. So they actually were able to give him, once he got out, he was able to go to rural health, and they were able to give him like a monthly Suboxone injection that would prevent him from getting out. And so that was like funded by, I think, the federal government, I believe.
They get supplements for
and that helped him out, but eventually I think he ended up going back to his old ways. But
that's one thing we need to consider. While this looks like a big pot of money, we need to look at other sources of funding that can help to supplement this money and potentially writing grants and so forth that can assist us with some of these things. I mean, Narcan, there's a lot of opportunities to get Narcan without spending our money. And so we need to figure out those kind of things that we can do to supplement what we're trying to do here. And so that's something, we need to look at, like I said, other funding opportunities.
Dan, will the trauma center need opioid settlement money?
It will.
Support that?
It
So
will.
we should take that into consideration too.
Yeah, I think the initial lift, we've got a pretty good sense on what the budget will be, but operational costs and programming that needs to be added to really serve this population in a center like that. We've got to build the ballpark first and see kind of, and just partner with our already established providers in the community that are doing this work right now, right? But how a facility operates for somebody to actually be in a safe place for multiple days and what other things that they'll need if opioid use disorders is one of their primary needs. Yeah, we're going to have opportunities.
But it's not going to be needed to build the building.
We don't estimate right now. We think we have enough in the budget to be able to lift it up, and all the construction costs between us and RHA, and the county already has allocated recurring resources for the operation of it. But most of it's coming from the state allocation, Via's contribution, and the provider's contribution to actually build it.
A lot of actions are pending in the legislature right now because last year they passed some legislation to allow for treatment of people in jail settings and those kind of things. But now that's all on hold because of the budget.
That's right.
And so we've got to wait and kind of figure all that out and see where the budget falls and go from there with those things.
Yeah, the biannual budget, when that fine day when it comes down and we'll see what that'll be what it is. But the good news is, as far as our funds that have already been secured, the state's already been very gracious to us from the last biannual budget that was passed. and rolling that over until we can get it built. So the state's been really a good partner in that.
And I've heard some of my commissioners mention a community paramedicine program as well that the opioid funds could support. So that would be good for y'all to have discussions and consider and recommend to the commissioners.
Yeah.
Because the current community paramedic that we have does not do case management for opioid. So it wouldn't be a bad idea.
Yeah, a lot of times those post-overdose response teams fall right up underneath the EMS.
And I know
community
a lot of other counties are doing that,
That's
funding it that way. So it's not a
There's
bad
actually,
idea.
I think there's actually a paramedic class, in HIT that's coming up this month or maybe next month for overdose response.
Okay,
I have to shoot you the dates on it.
can you do that for me? Please, thank you so much. And just to talk about, the county currently has $2,618,316 of opioid funds that there's been zero. We haven't used any funds, so that's the amount that we have right now. So a little over 2.6 million. And I believe we'll receive payments through 2039. So
Which they fall off after year 5, right?
Next
yeah,
year
it's
they
really
start.
heavy in the beginning. So yeah, that's about right. Yep.
And I believe that'll be that 5-year period will give us a jump start on developing other programs to have under that umbrella of the behavioral health. Because once we get people stabilized, how do we keep them clean? How do we support them? Supportive employment programs, helping people obtain jobs, building skills for people that may not have a high school diploma and things like that, to help them to be self-sufficient so they don't end up back in that same cycle.
Renee, do you have that collaborative strategic planning toolkit by any chance? That's part of option B. And it's something that I'm just, Randall, people here, we're gonna be going through it too. It provides essentially the methodology for how to do option B.
Okay.
I will email that to you and Sam, and if, well, perhaps everybody should.
Please.
Because there is a method that the state wants us to go through if we're gonna do option B. And the idea is collect your data first. Let your data tell you what of those strategies you want to pursue. And then you have to develop basically a justification, a report that then gets submitted to the county commissioners, they approve it, and then that gets uploaded. But there's there's more work involved in doing option B than option A, but there are a lot of counties doing option B, so.
Right. And I'll go back and look at the historical notes, but if I remember correctly, the information I found when I first came on board in 2023 was option B. So I'll bring that information back to your next meeting, because I'm gonna be researching over minutes.
Yeah, option A had a lot of administrative
Yeah.
burdens to
That's
it.
what I thought.
So that's why most people chose option B.
That's what I thought. Okay, all right. Okay, but I'll still find the meeting. and provide that as well.
One thing that I am hearing, and I guess it's, and from my own personal experience as an attorney, here in Vance County, we have a lot of juveniles who go through delinquency courses, but there is nothing for them here in Vance County to give them any kind of treatment options. I had one young man I represented, the court wanted him to take counseling. Every Saturday, his mother had to get him to Durham. He was too young to drive or whatever, and he could not get any help here, either group or individual therapy. He had to finish his course in Durham. And I think, that's one concern that the court system is where some of the parents, are having difficulty dealing with it, because you have a situation that's happening now is because of vaping. A lot of kids are vaping. My best friend, she's a licensed clinical addiction specialist, my grandson, she could not stop him. And she did try everything imaginable. She could not stop him, because once he left her house to go to school, it's in the school system. And the kids pass it around, like cigarettes or whatever. But they can go to the store, even Dollar General you know, she lives in Oxford, and her grandson was going to Dollar General and buying vapes. And, you know, and vaping, it was just something that he had obtained an addiction for. And I think once one child may start doing it, they're going to encourage other children in their circle to do the same thing. And a lot of these kids are at the age where they're getting at that pubescent stage, and, you know, they're trying to prove themselves and, you know, establish themselves as pre-adults, and then, you know, think I'm grown now, I can do what I want to do, and I'm going to do this, and then I'm sharing my friend because it's fun, and it's a problem, and it is really getting to a lot of parents, and, you know, because they do not want their children to graduate to stronger substances, and they want to get it stopped now, and, you know, a lot of these parents are desperate, you know, because once that child leaves home in the morning, goes to school, they have no control themselves of what their child's doing once they get to school. You know, so I think it's a big problem right now with vaping and stuff like that, and it's, you know, escalating to other drugs, and then they, you know, well, I can sell the vapes, but I can also start selling drugs, and, you know, I can, you know, make a little change for myself, and I can buy this child, you know, has the latest Air Jordans, I want me a pair, so they start thinking, making it a commercial enterprise. So we need to get these kids now, before they get to the point it's too late to help them. You know, a lot of kids, at least.
It's never too late.
Right, it's never too late, but when I say too late, I mean, a lot of them engage in adult activities, a lot of end up having children before, you know, that be, you know, starting families before it's advisable, you know, and then going on to stronger drugs. And so we need, and I know here in Vance County, some kind of way to reach these children, to let them know that there are better alternatives to some of the alternatives they're seeking now.
A lot of the higher success rates come from faith-based groups. And that's something that we need to, as we go through this process, need to evaluate and see how we can engage those faith-based groups.
And I also think, just from a provider standpoint, when we're reaching the youth, we have to reach their parents, because a lot of time when we get them into services end abruptly because the parents don't want to bring them anymore. The child won't get in the car to come, whatever those is. So we have to also educate the parents and making sure that they have the support they need to get their child into the service.
Well, and the flexibility of the service.
Yeah.
You know, you go to school during the day, mom and dad, you know, and you're gonna have to access most of the time something like that after school hours or on the weekend. And that it's tough to find that business model within a provider that actually continues to operate like that. We had a couple of people, a couple of organizations in Vance that try to do an adolescent, it's called SAIOP, like a more intensive, more frequent program. And, you know, operated after hours on the weekends and couldn't get the volume to sustain. They stayed open for about 2-3 years maybe, and couldn't survive. You know, the need is there, but for more intensive services, it's hard to get logistically that population to treatment so that they can.
One thing we could look at too, and I mean, I would need some help with big time, but we could look at doing some sort of public safety summer camp for the kids to attend. If we work together as a community with EMS, fire, law enforcement, and do some sort of summer camp, that way we could teach them first aid, we could teach them how to use Narcan, the importance of those, along with law enforcement, teaching them how to recognize these situations. I mean, even like an intern program or something along those lines.
I tell you, boredom and idleness goes towards all of what we're talking about for that population, and especially during the summertime, you know. I love that idea.
I love what you were saying about parents. Just simply working I work in another county in the substance use field and have for a long time, and I'm in recovery myself. And what I know is that most people don't understand addiction and substance use disorder until we learn it the hard way. We walk through it with our families, and it's a cyclone to navigate. If we can get parents buy-in into actually understanding, I mean, it's a multifaceted disease. It's not just a physical disease. If we can get that buy-in at home and get the kids that information, I don't know how, but I just, I did the I have facilitated SAOP and SACOP for years. And these young folks are coming from homes where it's never discussed.
That's right.
It's because it's not in our house. It's not gonna happen. And I get it. I grew up the same way, but, you know, it's gotta stop. It's gotta change at some point.
The stigma and labels.
And then even realizing some are doing it, they see the parents doing it, you know, and so we just gotta make sure we're, again, going to the communities, because you can have programs where they have to come to, but when you go to the home and, you know, institute things, it works better, because then what are your excuses? And like I said, I mean, people just don't understand it. They say, why you just can't stop? And, you know, and they don't realize that, yes, okay, yeah, I had a back injury and I need pain medicine, but then after addiction, your body begins to crave that medicine. And so they are mixing the two, like, oh, well, I'm still hurting. Well, your body's craving that addiction, want that medicine. And so just helping them to understand, helping to educate, you know, is the key. You know, knowledge is power. And when we take it to the streets and take it to the communities, then I feel we'll see better results. So I'm just excited to get started.
Anybody else have any other thoughts that y'all want to share?
I definitely think that we should bring up our buyer resource sheet and make sure that we're sharing that with the community. If it needs to be updated periodically, we need to make sure we're doing that, because people perish for lack of knowledge, right? And I hear consistently, oh, Vance County doesn't have this. We have so many agencies here that are being underutilized. So, but people may not know that there's a New Visions, that's a peer support. They offer therapeutic services. You know, they may not know that Visions has a walk-in center to help people. They may not be able to deal with crisis, you know, or they may not be able to evaluate for an IBC, but it's a center that you can go to if you're having struggles, if you're dealing with mental health, if your children are not listening and you just need to get that help. They can tap you into the right agencies and organizations, but people don't know. So I think educating the community with what's available, their hours of operation, their contact information. If we need to put it on some magnets, there you go. Some cards, right, something tangible that they can see and they can say, okay, you know what, I am fed up.
Great segue.
Let me go ahead and call Mobile Crisis. Let me call Visions. Let me call TTS. A lot of people don't know that these agencies are around.
That's right.
Yeah,
not
so
easy
I
to
think a
find.
resource
Paid
sheet.
for by Granville County opioid stolen money, just so you know. We have this treatment provider, that includes Vance, it includes Vance. And it's being updated as we speak, as a matter of fact. But what this also includes is, so Granville County, Vance County, other services nearby, along with safe use of drugs. If you're going to use, please don't use alone, always have an naloxone, as well as some digital resources that are now available, telehealth, as well as resources via phone, etc. And then and it's in Spanish as well, so English and Spanish. And then this little card that we have put together that includes the mobile crisis phone line, the VIA crisis phone line, 911, the Harm Reduction Coalition outreach worker, never use alone phone number, and peer warm line. And then the QR code will take you to the very outdated Granville Vance public health website, but along with the government, believe it or not, has this fine treatment locator that works really well, and it's really easy to use. So that's what that QR code, so English and Spanish. So these are available, and it would be lovely if some Vance County funds could support reprinting and we could get more out. But that's but that is there. The other thing I wanted to mention, just in terms of data, in my previous world, I was a director of a youth substance use prevention coalition. And we surveyed youth in the schools, 8th through 12th grade, every 2 years. And what's required, this is for a Drug-Free Communities grant, which is a federal grant that we're not even eligible here because we don't collect data. In addition to the survey, because it actually is a survey that we created that made sure it included all the required questions, which are 4 data points: past 30-day use, peer perception of harm, peer perception of the parents' disapproval, and peer perception of peer disapproval. We also surveyed parents to find out, what are your feelings about underage substance use? And do you have family rules? Do you know where your kids are, who they're with, what they're doing? Have you had conversations with your kids about discouraging them from substance use? So you learn a lot, and then we compare the parents' answers to the youth answers. I mean, it's not, we're not comparing one-on-one, but it's just aggregated, right? So you can kind of get a sense overall, this is what parents are feeling, this is what youth are saying, and it's really educational in that regard. A survey like that for kids, right? We've got the parent, what are we calling it? We have to get the kids buying,
Parent Bill of Rights.
Parent Bill of Rights, right? Which requires parents opting their child in. We always were able to opt out. We didn't have a parent bill, which is so much easier. But maybe it's just a slimmed down version of something that we could get board approval, school board approval. That way we'd know, instead of qualitative data, we'd have quantitative data, and then be able to do this every 2 years, position ourselves to be able to apply for this grant that would provide such important resources for the county, because it's focused on drug use and mental health for youth. So just something just to be aware of.
And I just want to throw this out here. I don't know if this is a thing or not, but are we able to maybe reach out to judges or prosecutors or people who deal these drugs and maybe maybe increasing?
So actually we have, Judge Caroline Burnett is actually on this committee, but she wasn't able to attend. So I think that'll be a question for her at our next meeting. But yeah, she just, sent an email, so she's not able to attend today, but she will have someone from the court system that'll be on our committee. Yes, ma'am.
And by that, you mean kind of reach out for education and engagement and treatment for, is that what you were saying? Engage them more, or what do you, what?
I'm more talking about maybe penalties, higher
Okay.
penalties for people who deal
I just didn't know
these
which way you were
drugs.
going with that. Oh,
So not
okay.
like drug court.
Okay.
Yeah.
Actually, I did speak to Judge Maggie Stevenson prior to the meeting. I had an hour to waste, but not waste, but just an hour, waiting for this meeting. And I went and spoke to her. She's in court. And I just asked her, her opinion. And basically what she said is jail is not the answer. Punishment, and that's what society, and a lot of the municipalities, the counties have been doing. They've been sending people to jail as the answer. But we need to understand people can get drugs easily in jail as they can on the street. And until we come up with an avenue where we can stop the drug trafficking that goes back and forth in our jail system, it's going to happen. And you have individuals going in, they may not be on drugs, but you sit down there, say 90 days, 120 days, or whatever, you get bored or whatever, and somebody has drugs or whatever, they may be inclined to give it a try. Once they get hooked, they come out, they're going to want to keep doing what they're doing if we do not have any kind of avenues in place to offer any kind of help. One of the things that I liked, as a county commissioner going to workshops, we learned of a program that addressed mental health, and it was called the Stepping Up program. And Mr. Brummer, he worked a lot with that. And that program was to target individual mental health, while they're in jail, and get them to help start the process. So that once they leave, there's, they have an avenue where they can try to still reach out and get some kind of help. And I think, in my opinion, doing that, in terms of the drug issue, may be a good idea as well, is to catch them while they're there. Those individuals, because you can easily do a drug test. The difference between when someone comes in and they're tested and they test positive, and then 30 days later, they still are testing positive, or 60 days or not, however long this particular drug stays in one system, that something has happened. They've had the opportunity to get their hands on it. And then the thing is, if they come in at a specific point of time, the question is, well, how did they get it? Who brought it in? So, we need to start looking also at individuals who may work there as well, because they're getting it some kind of way. I've been practicing law over 30 years, and I remember the first time I found out they make their own wine. I needed a garbage bag and some old fruit and some sugar they may, get, and they would make their own wine, and they would have wine parties. I said, no, because I was talking to the jail aides, and I said, yes, they do. I said, does it really make wine? They said, yes, it does. And, that's the income for some of them sell it, but they can make their own wine or whatever. And I remember hearing a story from one of the jailers that someone had brought drugs, and they had a fentanyl party. He called it elephant tranquilizer. Everybody put their things together. Then they had a great big party. And, some of the individuals overdosed, had to be rushed to the hospital. And if you have never, really been into that scene, and you go down to the jail or whatever, and you may give it a try where you otherwise may not have. But we need some kind of, in my opinion, avenue where we can detect those individuals who are engaging while they are incarcerated. Because then that way we may can direct them to where they need to go, or even inform the court system that in terms of their sentencing, they may need a little alternative sentencing, that encompasses, some kind of treatment aspect to, whatever their punishment may or may not be. But a lot of people, they may not be on drugs before they go, but once they get there, they want to, join along with what everybody else is doing. They want to fit in, and a lot of them get addicted. It doesn't take much for addiction, especially where fentanyl is concerned.
And we don't have a program in our jail either at this time.
We do.
We do?
Yes.
You're stepping up for mental health.
We have a psychologist that works in the
No,
jail.
I'm saying like if they are on drugs, like continuing like the Suboxone and things like that.
Oh, it stopped for a while, but then the process is starting back.
Okay, that's what I was
But it
saying.
has stopped, you're right.
That's
But
what
it's
helped
back,
my
it's
brother out a
back in
lot.
progress.
Because when he was in there, he actually had contact with a psychologist, and they were able to kind of help him deal with it. Now, I think at one point in time, he did test positive while he was in there, which, but he was able to get some help while he was in there. And then he was able to get out and get to rural health. They were able to provide that. But to this point as well, though, it's also providing that education to reintroduce them into society. Because if you're looking at going off of using drugs every day, the same people that you're around every day, stealing every day, just whether it be homeless or your family doesn't trust you, now you gotta go back into society and you don't know how to live. I mean, your whole lifestyle was based off doing drugs for however long, and now you have to. And that's the whole point with a lot of these rehabs, these different places, is to kind of provide education classes to teach you how to get back into it. So if you're going to jail, are we getting those classes in the jail to help them reintroduce to society, or because that's one of your issues as well.
You've got a resource that's baked in, but the need is always going to supersede what you have as far as substance use disorders are concerned and the criminal justice system. I mean, we did an early study in Stepping Up. I think we saw, what was it? Just over 30% had severe and persistent mental illness, but close to 8% of
74% of people that come into jails have co-occurring substance use and mental health issues.
That's right. So some of the access that they have to folks like Darren Coy, Dr. Coy, correctional behavioral health, has been working in Vance, And peer bridging services like Visions that'll help with a reentry kind of process is there, but is it ever enough, especially for folks that don't stand out. A lot of the ways he'll get involved is if somebody goes on suicide watch and they need an assessment for that. Well, that's going to catch.
Well, the other issue with jails is communication with our justice system.
Yeah.
We may have a person that's in jail, they're getting counseling services or whatever, and they think they're going to be there for another month. They go down to the court and the court says, you're free to go. They pack their bags, they get them out, they don't get a dose of medicine or anything, and boom, they're right back into it again. And so we've got to have that communication so that those people can get back into society and get the medication they need, and then be able to make those meetings after they leave the jail and then continue that counseling. And that's a communication thing that we've got to work out. And, we were short on resources in the jail and as far as personnel. And so that limits our ability to do those things. So we've got to fix all of it. There are a lot of problems we have to fix in order to get things in line.
Another data source that would be helpful too is the JCPC annual report. One of the things that Granville County's JCPC is going to consider is, and I did check in with the Association of County Commissioners on this, we can add opioid settlement money to JCPC money to expand the capacity of the programs that are being funded so that more youth are being served through JCPC. And from my perspective, and I don't know anything about Vance County's JCPC, but the 4 programs that Granville's doing, there's no sustainability. Like, we don't know 3 months after the program ends, has that behavior change continued, right? And so that's something that opioid funds could support, but less so than the actual servicing of those programs, right? So you can use a little for evaluation, but most of it has to be about service delivery. But that too may be another, target of your more troubled youth and kids who are at higher risk. So that maybe they're not using, but there's some behavior issues that can lead to that down the road.
Okay.
So that would be another good data.
So with stepping up, we've recently engaged with JCPC. There's a gap. Once a kid turns 16 years old until they're 18 or 19, there's a gap in services. And so that's where we're working on some things to try to support the JCPC and find programs. A lot of it comes down, and even in DSS with foster care. Everybody thinks the kids end up in foster care because the parents are on drugs. Most of the time, it's education of the parents. And so we've got to educate parents on parenting. And that's a key part of it. And until we're able to do that and figure that part out, I think NC Inc. ran a pilot, which was in my world not very successful. But they had a pilot where the monies were supposed to be spent on educating parents. And so that was state funded. And so that's some area where we can look to find some funding to support parents and educating the parents. The class that we just started with the fathers over with Dr. Macon. That program has been successful and looks like it's doing more than what the original 3P program was doing. And so it's got more substance to it. We've got to have more substantive programming to assist our youth, and that's where we've got to go.
There's even some programs that you can do in jail for young men before they're leaving, and we can tap into Sheriff Fountain in Granville because I know he's doing a Be a Man program in the jail, and that's something that we may want to incorporate and look into.
Okay, and I meant to ask y'all, do y'all want to have these meetings for an hour and a half or an hour? Today was just an hour and a half just because I felt like we needed that today. But moving forward, do y'all want an hour and a half? I didn't think about that.
You guys think
An hour should work.
hour should work. So time is precious and schedules are tight.
We're meeting every
So, my recommendation for the next meeting, if you're all okay with it, y'all let me know what y'all wanna do, is to do a deep dive into option B and the collaborative strategic plan. I think that's a good idea, if you all are okay with it, for that entire hour, before we can, move forward with, and think about recommendations to the commissions, just making sure that we all understand the MOU and what option B really means, if you all are okay with that, right? Is that okay?
And that gives everybody a chance to review it, bring back
Yes.
questions.
Yes, that's what I was saying.
Are you all having a program March 16th for faith-based?
That's
Yeah,
Monday.
so we've got the faith-based mental health initiative that covers Granville and Vance County. A lot of that, and that's in partnership with the health department, DHHS, as well, and just a lot of neighboring churches.
I think if many of you all can attend, there might be something good, because I was looking at the, I wouldn't say flag, you know, we used to call them flags, but it was on the Facebook this morning.
Yeah.
And it was talking about certifications.
Yeah.
I think if you all are interested, that may be a program you might want to attend, because you can get some very good information about, what may be available for communities and churches and other nonprofits and religious organizations that could be helpful, to the community as a whole, and also give you a certification to show your credentials. So, I plan to attend. I just saw it, this morning, but I thought it was an interesting program. I think it would be very helpful.
Yeah.
And when is it?
Yeah, we've certified, I'm gonna have to go back up on it. Hold
You
on.
said March 16th. You said
Yeah.
Yeah,
March
it's,
16th. I can send you the flyer and.
Okay.
I can send you
Just wanna
that.
get the right
Okay,
time.
perfect.
We've certified almost 50 churches in Vance County with mental health first aid. And I think the phase that we're in, as far as that initiative is concerned, and Kathy chime in, we've got some other folks from the health department that are more specifically involved with it. But we're trying, as far as this population is concerned, we're trying to see if we can just lay out some basic training, talk with folks about where resources are, how to engage folks just in the conversation. But I'm hopeful that churches will just become more interested in doing things like Celebrate Recovery and some of the community-based recovery models that we had at one point that have really dwindled over the last, I would say, 5 or 6 years, especially. We need more churches that are just willing to open up their doors and host community recovery groups. So anyway.
So that thing is tonight, isn't it? March 5th. Katie, aren't you doing a thing tonight?
That's tonight at Baskerville, the Vance Recovery.
Tonight? Yeah,
Basketball tonight.
yeah. So she's doing that tonight at 6 o'clock at Baskerville.
I saw hers as well, online as well. But the one I was referring to is
Is the Faith and Mental Health
yeah.
Initiative, yeah.
And if we can reach our faith-based churches, they can start knocking down some of these stigmatisms, right? Some of the stigma that we have on mental health and substance use, shining a light on some of these deficits that we have in our community. So when people are going through things, they can know that they don't have to do it alone, and that recovery is on the other side. Hope is there, recovery is possible, no matter where you are in that. Somebody's here to help you without a judgmental lens.
I think some legislation was passed last year before, for churches.
Nah, it was put in the operations rules and operations committee, and it's sat there since.
So it didn't, okay.
Yeah,
It didn't pass.
No. Well, it hasn't been voted down. It's still in the appropriations committee.
Okay.
Rules and operations committee, so. Yeah, there's still an active House bill for funding churches to incentivize them to go through this training. That if the legislature would rekindle a bit, it might get some movement, but we had a couple of legislators that had sponsored that bill and just didn't get reelected, and it's been sitting for almost 2 years now. If you don't mind, since you brought it up, I just wanted to share the details of the Faith and Mental Health Initiative meeting. It's March 16th from 6 to 8 p.m. at the Masonic Home for Children over in Oxford.
In the cafeteria.
It's in the cafeteria.
Okay. You have a flyer there. Okay, all right.
So 6 to 8.
Yes, ma'am.
Friday.
And for everyone sitting around the table, Dr. Auger and I do a trauma training. So if anyone is interested in having that training at their church, at their organizations, we've done it for the school. I've worked with Mary Luna McCool to work with the social workers and the case managers there and educate some of the teachers that were available. So if you want some of that training, please just reach out to me anytime and we can arrange something. Did anybody have anything else that they wanted to bring to the table? Yeah, Ms.
Thank y'all
Perry?
so much. This was a good initial meeting. So I'm looking forward to our meeting on April the 14th, at 1 p.m.
Yep.
That'll be our next meeting. April 14th at 1 p.m. And we will do a deep dive into option B and the collaborative strategic planning process.
If I may, just real quick, I just want to give kudos to the individuals in the room with lived experience. It's really hard in other counties that I work in. I serve on 2 of these committees in other counties, and it's really hard to get that perspective at the table. And I just want to call y'all out and appreciate y'all for being here. It's so needed in a group like this.
Thank you all.
Thank everyone.
Thank y'all.
It happened, Renee. You did it.
Yes, ma'am.
Uh-oh.
It's on the calendar.
Yes, it is. I already sent the invite out.
Yep.